Good news about some research that's been done at Trillium Health on injectable HIV drugs for treatment. The study is being presented at the 25th International AIDS Conference on Tuesday, July 23rd. This is the treatment revolution now with injectable drugs, and it's important stuff, as important as AZT was in those very early days. I mean, this is really the beginning of a whole new era in treatment. And overall, patients accepted the drugs, were very interested in the drugs, stayed on the drugs that were given every 2 months by injection. There were very few dropouts. They were well tolerated and patients had good outcomes with undetectable viral loads. So it's looking like people are onto something in terms of the revolution in HIV care, which involves injectable drugs. And you've probably seen some of those ads on TV. What this points out is there's a difference between marketing and science. And what we're doing is sort of backing up the marketing claims that say these drugs really work and patients like them. And it is a revolution in care. Marketing, as you know, is not always scientific. How's that? So we're not promoting anything, but we're talking about the science, which is important to know. I've been to these conferences before. It's always interesting because you get a global perspective on what's going on in the world of HIV. People from 110 countries, 10,000 or more people, so it's a big event. And it's always interesting to get some sort of flavor of what's happening elsewhere and how people are doing it. So there are always a lot of good ideas. Over the years, we've presented a number of things from the very darkest days of HIV in 1988. Most recently, in 2018, talked about our PrEP program, the HIV drugs for prevention of HIV called pre-exposure prophylaxis, or PrEP. Steve Scheibel and his husband Chuck Marbley came to the presentation. Dr. Michael Lecker, who is now in Washington, D.C., but at the time was our director of LGBT health, did the presentation. And it was, right ahead of the curve in that era, because PrEP was still getting started and was still gaining legs. Different story now, because we also have, in addition to pills for PrEP, we have injectable drugs. There's been a lot of movement in terms of advancing both the HIV treatment and the prevention side.